To share more, I am pleased to introduce our first speaker, Dr. Mark Robin, Medical Director at Dialogue. In addition to working as a telemedicine physician, Dr. Robin leads a Canadian multidisciplinary team of physicians focused on developing a patient-centered approach to virtual healthcare. Dr. Robin obtained a bachelor's degree in molecular biology from Laval University in 1989 and has carried out research in pharmacology, experimental medicine. After completing his medical studies in 1997 at University of Montreal, he completed his family medicine residency at McGill University in 1999 as chief resident. Dr. Robin worked at Stanford Hospital in Connecticut from 1999 to 2012, a major teaching facility affiliated to Columbia University College of Physicians and Surgeons. Plantree certified, Stanford Hospital is one of 17 acute care hospitals in the United States with this focus on patient-centered care. Dr. Robin was vice chairman of the Department of Family Medicine at Stanford Hospital, a member of the Stanford Hospital Medical Board, as well as medical director of an acute long-term care facility. A passionate sailor, he was a member of the Canadian sailing team and is still actively involved in the sport and with young athletes. Dr. Robin, over to you now.
Thank you, Valerie. Hello, everyone, and glad to be with you here today.
You're a busy person with a lot on your plate. But when you or your loved one are unwell, seeking care can feel complicated, time-consuming, worrisome. Your health should always come first. Dialogue is here to help. Access Canada's largest virtual care team of doctors, nurses, nurse practitioners, and other care professionals at your fingertips. They're dedicated to you and your family and ready to support you with personalized, warm care within minutes. It's easy to get started with Dialogue. If your organization has given you access to Dialogue, download the app and tell us a little about yourself. Whether it's day or night, weekday or weekend, we are here for you. Chat, call, or video with one of our healthcare professionals and tell us how you're feeling. You can schedule an appointment with a nurse, a doctor, or a mental health specialist at a time and place that works best for you. A prescription is needed? Your medication can be delivered right to your door or the pharmacy of your choice for free. We care about you, so expect us to check in to make sure you're feeling better. Your safety is one of our top priorities, and some issues may need a test, a specialist, or to be seen in person. We can help you find the closest and fastest care that you need. Our conversations are always confidential and secure. We'll protect your privacy with the highest safety and security standards in the industry. And don't forget, Dialogue is a family service. We provide the same great care for your family too, so be sure to invite your dependents. Access to excellent care doesn't have to be complicated. Dialogue can help so you can focus on the things that matter most to you. Health is everything. Don't settle. Humanized healthcare from Dialogue, exclusively for Canadian organizations, their members, and dependents. If you're a Dialogue member, download the Dialogue Health app and get started today at app.dialogue.co. Not a member? Speak with your HR team or organizational leaders.
Hello, everyone. Thank you for participating in this webinar on the role of telemedicine during the COVID-19 pandemic. My name is Dr. Mark Robin, and I'm the Medical Director at the Dialogue Health Technologies. We're going to be talking a little bit about telemedicine and what we call our Dialogue 101, the impact on COVID-19 and the advantages of telemedicine throughout the pandemic, the impact of COVID-19 on the utilization of Dialogue services, our service offer and typical time to access to care. We will share some success stories on patient journeys and discuss the impact of telemedicine on patients and organizations. What is telemedicine and what is Dialogue? Well, Dialogue's mission is to improve humanity's well-being by using technology to deliver excellent care. Translated into a pandemic situation, it's to allow accessibility and continuity of quality care by promoting distancing while using technology. Dialogue was founded in Canada in 2016. It is the largest virtual care clinic in Canada. We will perform more than 1,000 visits daily, surpassing Canada's largest ER volumes. And we provide services across Canada, bilingual, 24/7, 7 days a week. We employ more than 850 employees in our Montreal, Toronto, and Calgary offices, including more than 500 health professionals. More than 1,000 clients deal directly with the Dialogue, and more than 25,000 clients access Dialogue through corporations or insurance carriers. More than 3 million Canadian employees and their families have access to Dialogue services. What's unique about Dialogue's offer is only dedicated to employers, insurers, and organizations. Dialogue does not offer direct services to individuals. And that is the business model of Dialogue. In terms of medical model, Dialogue is a patient-centered, multidisciplinary approach where the best healthcare professional, whether that is a nurse practitioner, a physician, or a mental health specialist, or others, will assist you at any given time. And in health care navigation through the system will be offered when needed. And in all cases, follow-up is included. How is Dialogue different? We're the largest and most experienced medical team in Canada. We have, as said earlier, more than 500 healthcare providers. We offer fully bilingual services, a multidisciplinary approach, and we have an experienced medical leadership and a medical board that performs regular quality assurance audits similar to hospital settings. We've been working since 2016 to define virtual medicine and provide a safe scope of practice in virtual care. Our healthcare providers have dedicated shift. They don't moonlight. They are fully trained on our platform, and we can address all cases quickly and professionally. We have an amazing 360-degree patient care approach that ensures our patients get the care and health outcome they want and need. We have personalized follow-up after every consultation, and we'll check in on you and see how you're doing. We have optimized the logistical aspect of care to make sure that we have more doctor-patient time and interactions. And we will provide concierge-level navigation and support for all referrals to in-person specialists if that's needed. Another feature that's unique is our highest member engagement. As the largest telemedicine player in Canada, we have developed an expertise to onboard and maximize the success of a telemedicine program. We provide a complete white glove bilingual onboarding service. We have engagement campaign and ongoing education to drive member usage, and that drives positive health outcome. And we provide deep insights and anonymized reporting to give business leaders an understanding of usage and health trends. We are SOC 2 Type 2 compliant, meeting strict banking level criteria for security and privacy, as this is so important. COVID-19 and the advantages of telemedicine. 20% of Canadians wait 7 days or more to see a physician, and that's patients spend an average 4 hours for a medical visit. The Auditor General of Quebec tells us in her yearly report that 82% of Quebecers do have a family physician, but that 71% of emergency room visits are for non-emergency visits. And for 72% of those patients, they have a family doctor, which lets her conclude that the overcrowding in the emergency rooms is partly linked to the difficulty experienced by these physicians in seeing their doctor. So this is the status of healthcare before the pandemic. So what's the impact of the pandemic on our healthcare system? Well, 46% of Canadians believe that access to healthcare is more difficult due to COVID-19. This is from the report from Environics Research on Canadian attitudes on healthcare and telemedicine. This impact translates into decreased accessibility to healthcare, increased delays related to healthcare services, breakdown in continuity of care, increased risks associated with delay or lack of treatment. The accessibility to healthcare impacts absence at work for many Canadian workers. The advantages of telemedicine. Advantages of telemedicine. Telemedicine offers a new portal of entry into the healthcare system. I like to think of it as the smartphone as a portal of entry. In the traditional brick and mortar design, you wake up one morning, don't feel well, pick up a phone, try to make an appointment, try to reach somebody to give you an appointment, and you might get an appointment within 3 days or 3 weeks, which is the average, to see a physician, at which time you will leave your house, take public transport maybe, certainly wait in a waiting room, and invest half a day of work for that appointment. In contrast, in using telemedicine, you wake up feeling unwell, start a conversation on an application on your smartphone. The time commitment between I don't feel well and I'm discussing with my health issues with a health provider is counted in minutes, which is a big advantage, obviously, in a pandemic scenario. So the advantages translate into no travel necessary to get to your appointment. Don't have to be exposed to sick people in the waiting room. You can get your appointment from anywhere, whether home, work, or anywhere else for that matter, with reduced wait times. 70% of Canadians do believe that virtual healthcare is the future in healthcare for Canadians. In a time-saved study conducted by Dialogue, we asked members to self-report significant hours saved using our services. So this was a survey that was sent to nearly 13,650 members with the questions, how much time away from work did Dialogue help save you? 60% answered more than 3 hours. And in fact, the average time saved per care episode in that survey was 4.2 hours. And that's absolutely within what is out there in terms of data. So that's very significant when you start counting how many total hours saved 1,000 visits per day at Dialogue. So what's the impact of COVID-19 on the use of Dialogue services? In practical terms, Dialogue has increased its user base by 10x in the first few months of the pandemic, with peaks of up to 1,500 visits per day, while maintaining an access to a doctor or nurse practitioner below the 15-minute mark and keeping a very high patient experience satisfaction index. Chloe for COVID is an application made by Dialogue public to all Canadians early March. The pandemic required a infodemic management with accurate and personalized information available to all Canadians from trusted medical sources regarding COVID-19. We launched in March, on March 9th, and updated multiple times a day with the latest publicly available information and resources, including contact information for public health resources, but also offering up-to-date guidance based on user location, self-assessment tool for COVID-19, and personalized testing navigation for those who need it tested. This timeline illustrates the evolution of Chloe for COVID during the pandemic. We recognize January 25 as the date where Health Canada reported its first case of COVID-19. Chloe for COVID was launched on March 9th. On March 11 already, Quebec 811 line had received more than 16,000 calls. And by March 15, Chloe for COVID had answered the queries of approximately 600,200 Canadians. By mid-April, or by April 18, 73 users had used Chloe for COVID for their questions relating to the COVID-19, whether that is questions, symptoms, or where to get tested. And this is a good example on how using the leverage of information technology and the reach of dialogue, we were able to help the public health resources confront the need for information during that period. Services offered. As stated earlier, we see over 1,000 patients every day, and we keep a satisfaction score above 94%. A typical patient experience, I have symptoms, pick up a smartphone, start a chat with the applications, and within 5 minutes, you may be offered a consultation either right away or at a more convenient time by appointment, if it's preferred. And this consultation will always happen through a secure video conference. And at the end of a consultation, a care plan will be designed, and you will be receiving a copy of a care plan. Possibly a prescription would have been sent to your pharmacy, a referral to a specialist if that's required, or help with navigating the system if an in-person visit would be required, or an emergency room visit, for example. But in all cases, a follow-up will be done to make sure everything's okay. What are the top 5 attributes Canadians seek from a virtual care platform? Accessibility, as defined by a service offered by an employer, a student association, or a financial institution. Improved communication, the ability to choose the preferred mode of communication for the encounter. The timeliness and quickness of an appointment, quick access, timely access, possibility of scheduling an appointment according to patient's availability. The ability to have a follow-up with the same healthcare provider, that's very important. And the choice of the healthcare professional, or getting the appointment with the most appropriate healthcare provider at the right time for the problems at stake. Our patient experience is great. We have worked hard to optimize the administrative processes so more time can be spent with the patient, between the patient and the physician. We will never skip a case, no matter how complex. We will offer full concierge level service for in-person consultation referral if that's needed. And we offer true continuity of care for each episode of care with a personalized follow-up of the same medical team. I'd like to share a couple of success stories, and they really highlight here some of the comments we get on patients' journey. In this particular case, this is a parent writing back to us about a consult they had with their daughter. And so my daughter recently had a skin issue, an issue that scared us. In minutes, we were talking to a nurse We leveraged technology to diagnose the issue. We're probably speaking about pictures here. And she prescribed a medication, faxed the script to the closest pharmacy. They've checked in regularly, and we continue to use the app to monitor progress to date. Incredibly convenient, awesome service, very user-friendly app. The days of waiting hours in a crowded walk-in care clinic is over. Woke up with a sinus headache, had been more frequent, and tried the service. Spoke to a nurse practitioner within 5 minutes of completing an online intake form. Received a script for a nasal spray and a referral to ENT. He also checked up on me a few days later. So glad my insurance offers this service to me and my family. So this is a great story. What's the impact of telemedicine on patients and organizations? Well, we know 82% of Canadian workers believe employers should offer virtual care service. We know that each telemedicine consultation saves a Canadian worker an average of 4.1 hours of work. What's also interesting is 70% of workers, when asked, indicate that if they had the choice, they prefer to take an appointment outside their working hours. Clearly, telemedicine contributes to a reduction in absenteeism and presenteeism at work, and that's so important right now in these uncertain times. Thank you for your participation in this webinar. As we conclude this presentation, I hope we have demonstrated the unique approach of Dialogue in placing our patient at the center of a multi-specialty team, assuring that a patient will receive care from the best provider at the right time, whether that's a nurse practitioner, a physician, mental health specialists, or others. This is a unique approach as compared to both the traditional model or present virtual care offers. At Dialogue, we've been working for the last 4 years defining a safe scope of practice and have developed an expertise in providing safe, efficient, timely care to Canadians, workers, and their family. We're very proud of that. Thank you.
Thank you very much, Dr. Robin. That was very interesting. And now we will go on with our next speaker, who's going to be one of our own colleagues, Sunil Hirji. As Regional Vice President for the Ontario, Western and Atlantic Canada Business Development Team, Sunil plays a key role in ensuring that our commitments to both our existing and future clients are fulfilled. Sunil has been in the industry for nearly 20 years, and as a group insurance expert, he brings very strong understanding of the diverse needs of plan sponsors and advisors across the country. In addition to his wide experience as the son of a first-generation immigrant family, he understands the value of offering support to Canadians and helping them navigate through the Canadian health system. Sunil, the mic is all yours.
Thanks, Valerie. Hi, everybody. As Valerie mentioned, my name is Sunil, and I have responsibility for leading the Group Sales and Partner Experience team at SSQ Insurance for Ontario, Western, and Atlantic Canada. And we just got a very great perspective from Dr. Robin on how necessary and valuable virtual healthcare solutions are becoming for us as Canadians. And what I'm going to do is take the next 10 minutes to really just talk about how SSQ Insurance is helping make it easy for plan sponsors to deliver these services in partnership with Dialogue, in integrating them into your traditional benefit plans that we're offering. And although it might seem obvious, it is absolutely necessary for us as a benefit plan provider and just a service provider in general to continue our pursuit for innovation. I think if you take a look at any service industry, like Airbnb or Uber, there's a constant need to evolve. Airbnb has become one of the world's largest provider of accommodations. They don't even own their own properties. Not to mention the impact that they've had on other industries like our own regional housing issues. If you look at industries like, or a company like Uber, originally started focusing on generating revenue through ride-sharing programs. The pandemic has had to lead to an immediate need to kind of focus more on food delivery options for revenue generation. And it's no different in the world that we work in as benefit providers in our partnership with plan sponsors to really try and help ensure that their organizations are as productive as possible. Because the reality is, as Canadians, as both employees and employers, our needs as we look to take care of our own well-being are continually evolving. And at SSQ Insurance, what we're trying to do is make sure that we stay as in tune as possible with those evolving needs and finding the right partners to meet those needs, and then looking for ways to integrate them into our offer that allows plan sponsors and advisors to maintain autonomy in whether or not these are the right solutions for yourselves. If we look back over the past year, some publications were kind of issued that made it really clear about how prevalent the need and desire for these types of services are becoming. And virtual healthcare is at the top of the list of most desired for benefits for both plan sponsors and for plan members. Last year, 71% of respondents in the Sanofi Healthcare Survey said that they're ready to use the virtual healthcare technologies that might be provided. And those numbers only increase when you start looking at specific segments of those demographics that actually are going to be the future of our workforce. And, one of our own members, Melina Lamarche, is on the Sanofi Survey Advisory Board. And I'm just going to quote her. She said, virtual healthcare is gaining momentum, and with good reason. It makes it possible to obtain personalized medical support anytime and anywhere. The financial benefits are considerable, and the interest is more than present. Employees are easily ready. The time has come to seize the opportunity and reinvent our group insurance programs through digital technology. So if we go to the next slide, having our own employees at SSQ Insurance be such advocates for this type of service offer, it's no surprise that in 2019, we had, as SSQ, decided to offer this and integrate it into our own benefit plan. And prior to integrating a virtual healthcare solution through Dialogue for all of our employees, we were actually seeing that in comparison to the benchmarks of our industry, we were incurring higher absenteeism rates across our business. And after the implementation of virtual healthcare services, we saw ourselves do an improvement, and we're actually back in line with what the norms would have been. In addition, because we use various survey tools to check in on the pulse of our employees, we were seeing that people were really valuing the global compensation programs. There was a good perspective of the support being provided from their employer at SSQ. And last year, even pre-pandemic, we made a decision to take it to the next step and launched a pilot to offer a wellness and mental health module as part of the offer that we have with Dialogue to our employees at SSQ. And again, we've only seen, even although the results are, it's still early, but we're seeing unequivocally that the results are, there's again more improvement on that absenteeism rate, and there's a clear need for additional support, especially around some psychological assistance programs. I think we saw it earlier too from Dr. Robin that if we go forward on the next slide, the COVID-19 scenario has only heightened the need and the desire for people to participate in these types of programs. And within our own group, we saw amongst our eligible population an increase of over 400% of people registering for the service. And we saw, or we now have a 25% utilization rate for those that are registered on the service. And just like Dr. Robin has said, where they saw, a 10 times increase in the utilization of these services, I think it's really important to note, and I'm just going to reiterate it on the next slide, that while this exponential growth in offering this has become a big need, there's been no sacrifice in the level of the service being delivered, because the overall satisfaction scores are still really high at 92%, and the net promoter score within SSQ's employees still at 72%, which is an excellent score. So just to be clear on what it is we're talking about, it's as we mentioned earlier, it's getting the access to the right healthcare professionals when we need it. So through an integrated service with Dialogue, people will have access for healthcare practitioner consultations. They can get, renewal on their prescriptions through video consultations. They can get referrals and navigation through our healthcare system. But I think what's really, really important to note is that it's available 24/7 without the need to leave the comfort of your home, and with the increase in productivity, not just from a professional perspective, but in our own busy work lives, to gain that time back, that 4 hours, I think on average we saw in Dr. Robin's presentation, is being saved, and we're not having to wait in physician offices or travel to get to that access. So in addition to what's being offered to employees is convenience and productivity gains, is also shared on the side for our plan sponsors and our employers. When we talk about an integrated offer, what we're really talking about is helping ease the administration for our plan sponsors by integrating it into the same bill that would already be produced for your group benefits programs. It allows you to use the same listing or tools to administer who's eligible and should have access to that service from your employee groups. And it's included in the same documentation that talks to your employees about what they're covered for, what types of protections and services are included within an employer-sponsored benefit plan insured with SSQ. And all of those gains also shared those productivity gains, but it's, I think, of note to know that it's also there helping ease our public healthcare system from the stressors that are being placed on it all at the same time. So while it's interesting to hear from us, obviously, as an employer, I thought it would be interesting just to share some comments from a third party as well. Veolia, who's a current plan sponsor of SSQ Insurance, decided to offer their telemedicine services through Dialogue to their employee population in June of 2019. And so I'm just going to share their comments on what they had to say. For us, it was important to continue to innovate and to offer our employees virtual healthcare options to better respond to their needs. The response was extremely positive, especially since March of 2020, when the pandemic altered everything. They found themselves with an easy, accessible, reliable, confidential, and fast solution to respond to their changing needs. We are extremely satisfied with the unparalleled quality of their responsiveness, service, and follow-up. And as we continue to innovate, having Dialogue as part of our service offering puts us at the forefront of our employee benefits offering. We will continue to use this service to improve the well-being for our employees because they're happy with it. So there's clearly a lot of impacts, but I do want to quickly touch on one additional piece, and this is not shocking. I think, any time that we're able to integrate virtual solutions into what we're offering our customers, it allows for the ability for us to gain additional anonymized data. And having perspective on, what types of consultations have happened before our employee population over the past year is only going to give plan sponsors and advisors even more abilities to target and personalize the types of programs that'll help with their employee well-being initiatives. So if we kind of go forward, I'm just going to, it's been very clear. I think Dr. Robin shared a lot of statistics, and I'm quickly just highlighting the values of having an integrated solution. But I do want to take a quick note to kind of just share my own personal story. And I, having looked at the registration list for the event today, I know a lot of you have met me before, but I joined SSQ at the beginning of 2020. And in January then, it was great. It was exciting for me to join a new organization. But obviously everything changed in March. And there was a bit of an anxiousness about integrating into a new home professionally when I wasn't able to do it in person with so many people that I needed to do that with. At the same time, personally, it was a very difficult year. And for those who know my family, we had the unfortunate and sad instance that we lost our father in April to COVID-19. And, while we've come to terms with that, a really big challenge was, I've never had to manage, final rights for someone in a regular circumstance, but having to do it during such a challenging time was really overwhelming. And at the same time, not being to have the same avenues to, de-stress or decompress by meeting with family and meeting with friends really was taking a toll on myself personally. And I'm an extremely type A personality that needs to overachieve on everything I do. And I quickly reached out to Dialogue using their technology. It was about a 10-minute, questionnaire on what things I was kind of experiencing. I had people contact me within the next hour and a half for a video consultation. I was given, some quick tips on things I could do to kind of help me through, which was a very difficult time. And while I don't think I learned anything revolutionary in that, what I will say is it was extremely helpful. And the reason that I find it so valuable is I could have probably gotten some similar advice, but this was just so easy for me to reach out and connect with. I did it from my home in what was already an immensely busy schedule, and it had an extreme impact on the way I was able to cope with a really difficult scenario at the time. And not only do I see the value now as an employee, obviously, I work as a people leader and a business leader within SSQ Insurance as an employer, and I've been able to advocate how valuable that is to staff who need to make sure that they are protected in unique circumstances as well. And obviously, I've seen the gain of it too by just personally being able to access a service and keep my productivity level and minimize the time impact that it had dealing with that situation on what I was trying to achieve professionally too. So I don't think we need to say it anymore. It's clear that there's a value here, and we're trying to make sure that if you have needs and would like to integrate these offers in as seamless as possible manner, we'd encourage you to connect with your account execs at SSQ because we're all on board for supporting it as we need to. And on that note, I'm going to hand it back to Valerie.
Thank you so much, Sunil, for sharing that personal story. It's very touching, but also very relevant to how this service can be personalized and very practical and useful for all of us. Thank you, Dr. Robin, as well, for your presentation. Thank you both for your collaboration in this webinar that I think is very pertinent and relevant in terms of our needs today. And by the number of people that are joining us today, we do have a high participation and very happy of that. Thank you so much for being there. And it just shows us how this service can reach your needs and answer your needs. Now it's our time to answer your questions. So a few questions came through during the presentation. And I'll go for a first question that's directed to Dr. Robin. The question is, why should employers pay for the virtual healthcare services?
Good question, and thank you, Valerie. And Sunil, thank you so much for sharing that testimonial. And as difficult as this period must have been for you and your family, and I'm glad at least through decreasing the barriers to accessing some coaching and help, we were able to help if that's what we could do at the time. But thank you so much for sharing this. Why should employers pay for virtual care services? Well, from an employer's perspective, we know now that an employer providing access to virtual care is recognized as an employer of choice. In fact, we've mentioned earlier, 82% of Canadian workers believe their employer should offer telemedicine service. Telemedicine offers quick access to healthcare with a time commitment that we count in minutes. Companies that offer telemedicine services to their employees have found that it reduces absenteeism. It results in a greater job satisfaction and increased productivities. And so for an employer, for an innovative employer, it is the best way to protect their human capital and remain an employer of choice.
Thank you, Dr. Robin. And I think your answer very clearly indicates why it could be interesting for an employer to offer this to their employees. But Sunil, I'm going to direct this next question to you, because I'm sure that it's a question that all employers that are joining us today have. The first question is this service available for all groups, all sizes for the groups? So is there a number of employees minimum or whatsoever?
Yeah, thanks, Valerie. So for us at SSQ to be able to integrate the offer and have it all part of the benefit plan that's already insured, and that single same billing, and include information on in the plan booklets and documentation, we're looking at groups of 50 lives and over. However, the services are available for other groups as well, and what we would do is just look to get them in touch with Dialogue directly to make sure that they can get access to.
Perfect. Thank you. The next question that came in, and I think it's more directed for Dr. Robin, it's a question related to the doctors, our personal family doctor. The question is, will my doctor be penalized if I use the virtual healthcare services?
It's a question we run across sometimes. The quick answer is no. That Dialogue's business model is unique in that it is only offered to organizations. So there is never a financial transaction between a practitioner and a patient. So the patient will be seen in a consultation with a member of a multidisciplinary team. That could be a nurse, a mental health specialist, a nurse practitioner, or a physician. But since the third-party payer is an organization, and we don't bill either the patient or the public health system for that matter, even a physician who's paid under a family physician, the patient's other family physician, if paid under a modified capitation system, for example, would not be penalized. Therefore, we aim to complement the patient's treating physicians by promoting immediate, quick access to care, whether that's in evening or weekend. And we, in fact, provide the patient with a summary of the visit, which we hope can be shared with the physician at a later time or during follow-up.
Perfect. Thank you. And I think that this question is also going to be directed to you, Dr. Robin. Maybe you can answer this one, because we know that when we travel and when we will be allowed to travel again after this situation that we're going through, we don't have access to our family doctor if something happens while we're traveling. Do we have access to Dialogue services if we're not in our country?
That is a difficult one for healthcare providers in general. And so regulations in healthcare have to do with or licensing requirements in healthcare have to do with where you are physically located when you consult. So because jurisdictions, even in Canada, is between provinces, and countries have their own jurisdictions. Dialogue can be reached for general navigation purposes or general help. And so if we are in a position to locate the fastest, best way for you to access some care, we can help you with that. Physicians will not be able to provide diagnosis, treatment, or medicines or laboratories in a foreign country. That's true for every healthcare provider. And
Sunil, I don't know if you had anything to add on that answer of Dr. Robin. I think Dr. Robin covered the more technical part for the doctor's possibility to answer our services. But Sunil, if there's anything you want to add in terms of the service offer outside of Canada.
No, I mean, there's not much more to offer. Like you said, it's due to legislation that they're a bit restricted on what they can help, but the navigation aspect is obviously there. And all I would say is, if we're looking to make sure that our people, our prized possessions are protected, if they're abroad outside of jurisdictions within our own country, by all means, feel free to reach out, connect with account execs on what offers exist in terms of managing medical coverage when you're outside of Canada.
Perfect. Thank you. Sunil, the next question is for you. The question is very specific in terms of the mental health program. The question is if it's available through SSQ customers, for SSQ customers, I'm sorry.
Thanks, Valerie. Not yet. I mean, we were doing a pilot project ourselves in 2020, and obviously it's been going well. But we are looking to see if this type of solution can be integrated into our offer, as well as a number of other options that are on the table right now too. So not as of today, but they're continuing to explore how to better and better support those types of needs.
Perfect, thank you. We do have time for a couple more questions. Thank you for participating in the Q&A. Always very interesting to see what's coming up for questions. Dr. Robin, what's the approach for Dialogue to ensure the consistency and the quality of services you offer? Oh, I think your mic is off, is closed. Yeah.
Am I back? Thank you. Sorry about that. Dialogue, we have a medical committee and a quality committee that operates a little bit like a large hospital would. And so we are the only telemedicine company that invests so much in quality in this way. And as a technology company, we use this lever in a very advanced way in our continuous improvement processes as we define scope of practice and quality care in virtual medicine. And so through audits, for example, we're able to demonstrate that our practice, be it the judicious use of antibiotics, for example, or a safe referral to patients in whom an assessment indicates that a physical examination would be indicated, is fully compliant with the highest standard of good practice. Indeed, I would humbly suggest that in telemedicine in Canada, we actually set the standard for good practice. The Canadian Medical Association's playbook, the telemedicine guide for Canadian physicians, was in fact written by physicians at Dialogue.
Very interesting. Thank you. The next question is for Sunil. I think this is, of course, a question that comes up, that's coming up a lot. There's kind of a sub-question to my question. So first of all, could we purchase this service, so virtual healthcare service, as a standalone product? And if so, what would be the cost? And if it's integrated in my actual policy right now, what would be the cost to add on that service?
Thanks, Valerie. Yeah, so I'll start with if it's already going to be integrated as part of a larger benefit plan offering already in place. It really does depend in terms of cost on the size of the group, but an account executive will be happy to help you price that out for a specific situation. And in regards to utilizing virtual healthcare services on a standalone basis, what we would be doing in those situations is just looking to connect our plan sponsors with our friends at Dialogue directly. And in our situations where we're integrating, we have the ability to leverage a preferred pricing agreement that we've got in place with them at Dialogue.
Perfect, thank you. We have a question for Dr. Robin that just came in. It's a technical question. So can an employee get a doctor's note if they need to miss work?
Yes, of course. The virtual medicine does not discount the rules or good practice of medicine, all right? And so patient consulting on a virtual care platform establishes a treatment plan with a provider, and that there's a duty of care and continuity of care that ensues. And so, if indicated, of course, a leave of absence can be written. Now, in virtual medicine, for example, work accidents, physical injuries are not amenable to a good evaluation because of the absence of a possible physical examination. So we have to, if it's about a work accident or a traumatic accident, of course, you need to be redirected for a proper physical examination. That's just good medicine. In a mental health scenario or another medical scenario that does not require physical examination, of course, the same route, the same plan of treatment that would be offered during inpatient visit would be the same. The advantages is that it's very easy in virtual care to have a quick follow-up. We'll reach out to you the next day or a couple of days later and see how you are doing. And in fact, in leave of absence, and we've talked a little bit about mental health, but we have demonstrated in our mental health offering a capacity that by reducing the barriers of care, the time between I should talk to somebody about this and actually the ability to do it is such that we can catch and help people quite a bit earlier in the continuum between mental health and mental illness, and keep people at work. And when there is a leave of absence, we've shown that we can decrease that leave of absence by about 30% over what is found in the traditional model. So not only if required, we can issue one, but if there is such a thing as a leave of absence, we can optimize the return to work in virtual care much better, probably because of the reduction of the barriers to care.
Thank you, Dr. Robin. That's very interesting. I do have a question more specific for Sunil that came in. Can employees opting out of the medical benefits be covered for this benefit?
Very simply, yes. I mean, it's part of the employer-sponsored program. So, not participating in health or dental coverage due to a spousal opt-out does not take away from the eligibility of the member for accessing the virtual healthcare technology services.
Great, thank you. Dr. Robin, back to you. A good question here. Are health records from the family doctor available to doctors on the platform and vice versa?
No. Health doctors from your family physicians are kept by the family physician. So health records, in fact, belong to the physician, and patients can access them, but they're not shared. The Quebec medical or the Canadian medical systems does not have universal healthcare records that are shared. Now, parts of it are, whether that's pharmacy, labs, or x-rays, but not the actual record. And that's just the way the Canadian healthcare system and Quebec healthcare system for us here is designed. Now, what we do to help empower the patient, take charge of his health, and share the virtual care encounter with his physician is to provide a summary of the visit, which details the diagnosis, the treatment plan, the do's and don'ts, and the reasons to consult again, and so it is clear in a very shareable format, so to speak. And we will follow up 100% of the time if there is a laboratory or other tests that have been ordered, just to make sure that that's available. Now, we can always transmit those information directly to the primary care physicians.
Perfect, thank you. I do have an interesting question again for Dr. Robin. Can you speak about how Dialogue supports a diverse member population, those seeking an indigenous healer or faith-based health provider?
It's a good question. Dialogue is a very inclusive community of practitioners, and we hope to offer that services to everyone. We are in the business of primary care and mental health, and also EAP. In terms of primary care, we do have a wide scope of practice that would be similar to any primary care physician in Quebec or in Canada. So we are submitted to the same scope of practice with the limitations of virtual care. We are open to supporting, empowering patients and supporting patients in maintaining their level of wellness. And we will work with the patients in how they want to achieve those goals. And that's we are trying to accompany and complement really the patients and their primary care provider in that endeavor.
Great. Thank you so much. I see the time going by, and unfortunately, this is all the time we have for us today. We will make sure to answer all questions that we did not have time to go through today by email again on a personal basis in the next couple of hours. You will also receive an email tomorrow with the recording of this webinar. Please feel free to share it with your colleagues or anybody in your family that may be interested in this information with other organizations. You will also receive the link to complete a survey on your appreciation of what we presented to you today. Dr. Robin, Sunil, thank you so much for your time today. Thank you, everybody that's at the end of this webinar. Your participation is very appreciated, and we wish you all a great day. Thank you so much.
Thank you.
Thank you.